Did you know some medical tests that once saved your life might actually harm you after 70? It sounds backwards, right? You've spent years doing the right thing. Annual checkups, scans, screenings. But here's the surprising truth. After a certain age, routine testing can become too much of a good thing. According to a Harvard Geriatric study, nearly 1 in 3 seniors over 70 undergo tests that show no real benefit and sometimes lead to unnecessary treatments, anxiety, or even complications. So today, we're cutting through the noise. These are 6 common health checks that experts now say many people over 70. Did you know some medical tests that once saved your life might actually harm you after 70? You'll learn why more testing isn't always better and what's actually safer instead. Stick around, you won't believe what's 2 on this list. And down in the comments, I'd love to hear, have you ever felt over-tested or pressured into medical procedures you didn't really need? Number 1, annual full body scans. It sounds protective, like scanning your whole body will catch every hidden problem before it starts. But according to physicians at Mayo Clinic, full body scans in people over 70 often do more harm than good. Here's why. These scans tend to find incidentalomas, little harmless spots that trigger alarm. Then come repeat scans, biopsies, even surgery, all for something that might never cause trouble. A study in JAMA Internal Medicine found that up to 85% of seniors' incidental findings were benign, yet nearly half led to further invasive procedures. Take Rose, a 74-year-old retired nurse from Arizona. She paid for a private full-body CT just to be safe. It found a tiny lung nodule, which turned out non-cancerous, but led to surgery complications that kept her in recovery for months. Stick to targeted screenings advised by your doctor based on symptoms or specific risk factors. For most healthy adults over 70, less scanning means more peace of mind. Next, the most overused test among Americans over 70, and it might surprise you. Number 2, routine PSA tests for prostate cancer men. Every man wants to stay ahead of prostate issues, but after 70, routine PSA blood testing can do more harm than good. Here's the catch. PSA levels often rise naturally with age, even without cancer. That leads to false alarms, anxiety, biopsies, and treatments with side effects like incontinence and fatigue. The U.S. Preventative Services Task Force now recommends against routine PSA screening for most men over 70. George, 76, learned this the hard way. His rising PSA led to aggressive treatment, but the tumor was slow growing, unlikely to ever harm him. The radiation left him weak for months. If you're over 70 and not showing symptoms, talk to your doctor before testing. For many, watchful waiting and lifestyle care beat aggressive screening. Number 3, yearly mammograms. After 70, the story changes for breast cancer screening too. For younger women, mammograms can save lives, but past 70, evidence shows the balance shifts. The National Cancer Institute reports that for women over 75, mammograms detect slightly more false positives than real cancers, leading to anxiety, unnecessary biopsies, and overtreatment. Linda, 78, shared how her routine check found a slow-growing lump. Surgeons removed part of her breast, but later doctors said it likely never would have spread in her lifetime. Most experts suggest discussing screening frequency with your physician, every 2 years, or stopping if your health is stable and life expectancy is strong. Personalized risk is key. Next, one test almost every senior keeps doing, but few realize how risky it gets with age. Number 4, colonoscopies after 75. Colon cancer screening saves lives, but beyond age 75, routine colonoscopies often do more harm than good. The risks of bleeding, perforation, and anesthesia complications rise sharply with age. According to a 2023 American Gastroenterological Association study, seniors over 75 faced 5 times the risk of serious complications from colonoscopy compared to those in their 50s. Take Frank, age 79. He went in for a routine scope and came out with a hospital stay after internal bleeding. The test showed nothing dangerous, and doctors later admitted he probably didn't need it. If you've had clean colonoscopies before, stop at 75 or switch to non-invasive stool tests like FIT every 1 to 2 years. They catch warning signs without the hospital risks. And number 5, one you see advertised everywhere, bone density scans every year. Over 70, many women and men worry about fractures, but too many bone scans can mislead both patient and doctor. Bone density can fluctuate naturally, and repeating tests annually might show false declines. A Yale University review found that yearly bone scans often lead to overprescribing medicines with strong side effects like jaw pain and stomach irritation without real fracture protection. Remember Alice, 72, from Florida? Her bone score barely dropped, yet she was prescribed heavy medication. A year later, she suffered heartburn and fatigue with no measurable benefit. For most people over 70, testing every 2 to 5 years is enough, unless your doctor sees rapid changes or you're on long-term steroids. Focus more on vitamin D, balanced exercises, and fall prevention. Finally, the most overlooked testing trap in all of senior health. Number 6, heart stress tests and routine ECG. Doctors once believed annual heart tests after 70 were protective, but for healthy seniors with no symptoms, they can spark chain reactions, unnecessary stents, unneeded medicines, or anxiety over borderline results. According to Cleveland Clinic cardiologists, people over 70 with no cardiac symptoms rarely benefit from annual ECG or treadmill tests, yet false positives are common, leading to hundreds of unnecessary procedures each year. Joe, 71, went for a stress test just because. The scan flagged a minor blockage. He underwent angioplasty only for later doctors to conclude it was harmless, age-related stiffening. Get evaluated only if you have symptoms like chest pain, dizziness, or shortness of breath. Otherwise, manage heart health with walking, hydration, and blood pressure checks, not endless machines. So what's the big lesson here for those of us over 70? When it comes to your health, less is sometimes more. Too many tests can create new worries or even harm from treatments you never needed. Doctors now emphasize selective testing, tests guided by symptoms, risk, and quality of life, not habit or fear. Rose, George, Linda, Frank, Alice, and Joe all learned that routine care is not always routine anymore. What helps at 50 can hurt at 75. So as you age gracefully, let wisdom replace worry. Before signing up for another test or scan, ask your doctor, will this result change what we do next? If not, it might be one to skip. And remember to share this video with a friend or parent over 70 who's navigating these same medical choices. Drop a comment. Which test surprised you the most today? I'm Dr. Rose, reminding you that good health after 70 isn't doing everything. It's knowing what matters most. Subscribe for more clear, science-backed senior health explainers, because knowledge protects better than over-testing ever could.